Hello, everybody. Thanks for tuning in. My name is Rafael Curiel, and you're on the City of McAllen Employee Wellness page. And I'm joined today by some awesome experts from DHR to talk about COVID-19. We're here with Elizabeth and Dr. Cardenas. And I'm going to pass it over to Elizabeth so she can tell you a little bit more about Dr. Cardenas.
I want to say hello, and I want to say thank you to Rafael for allowing us to come to the City of McAllen to do this presentation. We normally do these presentations with wellness. And so I'm a registered nurse with the wellness department. And today we have Dr. Carlos Cardenas, and he serves as a chairman of the board at DHR Health. His specialty, and I'm going to let him introduce himself as well, but his specialty is gastroenterology, and he has more than 35 years of diverse experience. He's in gastroenterology as well as internal medicine. And I think he's also a musician with the DHR Rockers as well. So I wanted to let everybody know about that as well. Dr. Cardenas, go ahead and take the.
Sure. Well, thank you for having me. It's really a pleasure to be here during these trying times. Just a little bit about myself. As you said, I've been practicing gastroenterology. I'm a McAllen native, born and raised in McAllen, went to McAllen High School, and then went off to school, came home, and got together with some people and decided to build a health system. That's called Doctors Hospital Renaissance Health System, DHR Health. I'm also the past president of the Texas Medical Association, representing 52,000 physicians and medical students. So I have a little bit different perspective than a lot of my colleagues do, just simply because of my experience. But I'm here at your disposal to talk to you about, what is essentially a public health crisis.
Great. So today's topic is going to be on, on COVID-19. Okay, and I know we have had this pandemic going on, and it's like Dr. Cardenas said, it's a health crisis that we're facing right now. So today's topic is on COVID-19. We're going to kind of discuss a little bit about the increase as the dates are going by, as the current status, signs and symptoms, treatments. Where can we get testing, and what are the treatments that are being offered to us as in the community?
Sure. Well, I'm gonna take this in pieces.
Okay.
Let's talk about the incidence of the disease and what's happened in the community. Things were really very good through most of the spring. We made it almost to Memorial Day, where we had very few people hospitalized at that point. Mm-hmm. In the last 3 weeks, we have had a greater than 75% increase in hospitalizations, and that has not stopped since. So we, for example, in our special infectious disease unit, which we have set aside for people with COVID-19, we had maybe 3 patients before Memorial Day. Since then, we are at capacity. I have more than 56 in the unit today. We have had as many as 17 or more and growing on ventilators. So this is a serious illness, a serious problem. And there's been a lot of misinformation out there in the community that this, that maybe this isn't real, that we don't need to wear masks, that we don't need to be doing different things. None of that is true. What's true is that this is a very real problem, a very real disease. It is easy to pass from one person to another. And that's why when we talk about the things that you can do to help prevent this illness from happening to you or to somebody in your family, they're really very simple. And that's one is to maintain social distance, at least 6 feet apart from each other. Don't attend large gatherings. Mm-hmm. Wash your hands and wash them for 20 seconds. Do not touch your eyes, your nose, your mouth, or your face with your hands. If you wear gloves, wear the gloves and then take them off after you've done the task that you're going to do. For example, if you're going to go put gasoline in your car, that's a low risk activity, but still a possibility. Put a glove on one hand, put the gasoline in the car, finish that, use your glove hand to tap in the information on the keypad, take the glove off and throw it away. Your hand is still clean. But if your hand is gloved and you use it for everything else, then it's as dirty as if you never washed your hands. Mm-hmm. So it's really important to think about that. Those are the kinds of things that we can all do that help to protect us, each of us, from the virus, and at the same time, protect others from us. Wearing a face mask, big deal. Great thing to do. It protects everybody from you, so that if everybody's doing it, then we're all protected from each other. And we can reduce infection because this is passed by droplets. So it can pass from singing out loud. It can pass from speaking loudly to other people, breathing heavily, and that's why you shouldn't be close to each other. Not a good idea to, be on a treadmill and then have somebody 2 feet next to you on another treadmill. Mm-hmm. Not safe. They should be distanced apart. Those are the things that we can do that are easy to do, don't cost any money, and help to prevent the disease.
Mm-hmm. What about, let me ask you, what are the signs and symptoms that we should look out for?
So COVID-19 and the majority of people will show up and have similar symptoms to flu-like symptoms. Runny nose, cough, and fever are the big ones. In some groups of patients, onset of acute diarrhea can be a sign of COVID. Loss of the sense of smell can also be a sign of COVID. And so these are all symptoms that people can look out for. And that's why it's important, just like with the common cold or just like with the flu or other illnesses, that you wash your hands, wear a face mask, maintain social distance, and be mindful of what you're doing. Wear your face mask. Those are the things that, again, that helps for the flu, helps for the cold, helps for all the other problems we're talking about, and COVID-19.
Okay. I think Rafael had a question.
Dr. Cardenas, thank you so much for all this awesome information so far. Quick question. We hear a lot about quarantine versus self-isolation, and for a lot of us who are just barely learning about these terms, sometimes it perceives to us that in the media that these are interchangeable. Do you see that there's a difference? Are there any type of special insights that you can offer us, those of us that are just kind of watching from the outside for the first time?
Sure. So if you have symptoms, let's just say, for the sake of our discussion, you have cough, you have maybe a runny nose, and you have fever, and you've been tested because they thought you might have COVID. You get tested, which is a nasal swab. You get sent off to the laboratory, and it comes back positive. What do you do? Well, you need to talk to the people who've been with you at your home who may have been exposed to you in the last several days, within the last week to 2 weeks, because they could have potentially been exposed as well. And those individuals should consider self-isolating at home and monitoring themselves for fever, maybe taking their temperature twice a day and looking for fever, signs of a runny nose, signs of cough, etc. And then the person who's infected should self-isolate at home. They should stay in a room by themselves. They should have their meals by themselves. They should do everything by themselves. They should bathe by themselves, have everything separate within the home so that they can care for themselves. Doesn't mean you can't talk to them on the phone. You can talk to them on the phone. But that's the best way to try to isolate the problem and keep it from infecting others. And those are the kinds of things that we can do that really help to control and contain the virus.
Okay, so as far as testing centers go, where can we get tested if some of the family members or anybody that we know needs a test?
So there are a variety of tests that are out there. The test that is important, the test that should be done, the test that is reliable is a test that actually tests for the virus, not the antibody. An antibody doesn't tell you when you were infected. All it can tell you is that you were infected, but it doesn't tell you when. So if you look for the virus, that's a PCR test or a viral antigen test. And I know those are all words that we use in medicine, but these are the tests that are important because these are the tests that actually test for the presence of the virus. that's what you want to know, because that's what tells you what you need to do next. Testing centers, UTRGV has several testing centers that are set up. A lot of that is on their website. There are a variety of testing centers that are being supported by the state of Texas as well in the community. And you can check on a variety of health system websites in the community for actual screening centers. And there are many private physicians in the community who are doing PCR tests as well, and you can get tested at those facilities. Now, not everybody needs to be tested. The people that need to be tested are people who are symptomatic, who are having symptoms, fever, cough, runny nose, those kinds of symptoms. Those are the folks that need to be tested, because those are the people we need to identify and isolate, and then do the tracing to figure out who they may have been exposed to, because those individuals themselves may become ill or sick. Now, the majority of people who get ill with COVID-19, it happens within the first 7 to 8 days is when you usually see the illness take place, but it can happen out to 14 days. So the majority happen in that first week, 7 to 8 days, and then you see it later. And if you look at our graphs, and if you look at the graphs that have been published in the Monitor and in different places, you can see that indexed events like Memorial Day, when did the peak happen? About a week later, 7 to 8 days. So that makes my point. And so the math is there. The mathematics shows you. And so what it's doing right now is it's growing quite a bit and very, very rapidly in our community. And so that's why we are so concerned about people following the things that we talked about at the beginning of our Zoom talk today.
Correct. And we're coming across a holiday, which is 4th of July holiday. And so I guess we would just want to remind the community, we want to remind everybody to just keep safe, right? Follow the same precautionary measures that you mentioned right now: social distancing, washing your hands, not touching, your face and, your nose, your mouth, things like that with your hands. And if you do, wash your hands for 20 seconds at least, right?
Yes. And don't congregate. Exactly. That means, mira, put a lid on the pachanga, okay?
Exactly.
I know you love your family. I love mine. If you really love your family, don't get together with your family. I can't tell you the number of cases I've seen in the last 2 weeks that have come from birthdays because everybody decided together to go see abuelito.
Exactly.
Or everybody decided to go see abuelita. You don't want to give this to your abuelito, and you don't want to give this to your abuelita. And you don't want to give it to your tios and your tias either.
Exactly.
Because those are the people who are going to get ill, and your abuelito and your abuelita don't have the defenses to guard against the virus like younger people do. In general, this is a less severe illness in young people than it is in older people. However, more than 40% of the cases we are seeing right now are in people under the age of 40.
Wow.
40%.
That's interesting.
And some of those patients, some young people, are on ventilators. So to think that this doesn't become a serious illness in young people is not true. This is a serious problem. Not everybody's affected the same. So the best thing we can do is to do those things that we know how to do, and that is to do the things we keep talking about. I sound like a broken record, but it's because that's what you got to hear. You got to hear this several times and understand that this isn't made up. This isn't bull. This is the truth. This is what everybody's got to listen to and get the point across. Because we are our best friends to help each other, but we can be our worst enemies if we don't do the things that we need to do. Now, you wanted to talk about treatment earlier. There are a couple of things that we're doing here at DHR and a couple of other centers in the Valley. We're using convalescent serum, which comes from blood that is donated by somebody who got sick with the virus, with COVID, got well, and now are doing fine and have antibodies. And the ability to fight, that part of their blood has the ability to fight the virus. So we're participating in a national study treating people with convalescent serum and virus. I mean, in other words, not the virus, but the antibodies to the virus. Mm-hmm. Now, I want to take this opportunity to plead to the community that if you or somebody you know has been sick with COVID-19 and survived and got well and did well and doing well, you should consider volunteering to donate plasma, because that plasma could potentially be very a wonderful treatment and or potentially life-saving for another person. We can't make that stuff. We have to go harvest it. It comes from blood. So it comes from people donating. And so another reason to donate blood is that. And so that'd be one ask I would have. Beyond that, we are also here at DHR and other centers in the Valley are participating in a trial and using treatment with a medication called remdesivir. And remdesivir has also been shown to be effective. It is in, again, convalescent plasma and remdesivir are both rare resources. We don't have a whole lot of it. It's being used primarily in the sickest of the sick with the virus. And as supplies increase, we can make it available to more people, but right now it's a scarce resource. And COVID tests, we have a lot of testing in the community. But again, that's also a tight resource that we need to be mindful of as well. And that's why we're testing people who are ill or sick and not everybody on the street. Hopefully in the future, when we have a reliable antibody test, then we can do blood tests on everybody, whether you're symptomatic or asymptomatic, to get a much better idea of how many people out there in the community may have had the virus and never knew they were sick. Because that happens. That happens. It happens in other illnesses too, not just COVID, but in other viral illnesses, people get sick and they're obviously sick. And then you have groups of people who got the virus and were never sick, but they had the virus. And the worst part about COVID is that you could have the virus, not be ill and sick, and be spreading it to all your friends and family. So again, that's why we talk about the not congregating, not coming together, not having the pachanga, not having the, it's been so hard on our people and our families, because I know how we all are. I mean, I grew up down here. I know it's very difficult not to attend a funeral. It's very difficult not to go to a wedding. Very difficult not to go to a quinceañera. Very, very difficult not to go to the weekend barbecue with all your buddies. We all want to do those things, but I want to continue to do it with all of my buddies. I don't want anybody to get sick. And worst of all, I don't want anybody to die from this problem when it can be prevented. And the tools for prevention are in our hands. We can do this. We can do this.
Yes.
Somos familia, todos.
Absolutely.
That's us. That's how we are down here. And we did a great job on the front end of this thing. Let me tell you, I think we did a great job. And my hat's off to the bishop for having acted early and not having people go to mass and giving them dispensation so they didn't have to go to mass, because that really helped us to slow the spread. And unfortunately, I think as people congregated and done things like we're talking about, we've seen a real spike in the virus, an uptick in the virus. And there's a lot of misinformation out there on social media. And it's obviously somebody who's not taking care of this problem on the front line, because I can tell you from being on the front lines with my colleagues here at DHR and our colleagues in every other health system in our community, at UHS and at NAP in Weslaco and in Mission, everywhere across the valley, we're all seeing this and we're all seeing it about the same. I mean, we're not any different than the other. Everybody's seeing about the same level of increase. So this stuff is real. I'm hoping that everybody's listening today, that they listen to us, listen to you, and do what we're talking about, because the power is in our hands to help do the right thing.
Totally agree with that. Dr. Cardenas, I want to thank you for coming on. And of course, we have these new tools nowadays where we don't have to gather in large, we can actually, go via Skype or Zoom and all these great technologies that we have nowadays. And so, but thank you for this valuable information that you've given us. And I think Rafael might have a few comments or questions.
Oh yes, I just wanted to offer a sincere thank you, Dr. Cardenas. I know that you said that you're putting that message out as much as possible every day. And you never know, this could be the one video that changes somebody's mind. They're hearing it from a local doctor who's been doing so much for the valley already, and it just makes it more personal for a lot of our followers. And we're hoping to have you again on sometime, and hopefully it'll be with some good news about our numbers dropping. I can't wait to
Yeah,
see
absolutely. And, you know, like I said, the power is in our hands, each one of us. And, you know, for those out there that were wondering where my mask is, it's right here. I have it with me, but I was in a room by myself, and I was afraid you might not be able to hear me, so I didn't know if you could hear me. But I'm in a room by myself, so that's allowed, and that's why I was talking like this. So my voice is a little loud anyway, so it works out. But I want to thank you, the City of McAllen, for doing this and getting it out there. I mean, the things that you all have done for our community and continue to do for our community, like we've done the Toys for Kids every year for so many years, that I know this is just another challenge for us to do what we can all do together to make us better, so that we can go back to having pachangas and go back to doing the things that we know how to do with our families. But let's do the right thing for our families, and everybody do the things that I've talked to you about. Be careful with the things that we've talked about. We can get through this, all of us.
Awesome.
Everybody stay safe.
Thumbs up. Thank you so much.
All right.
Thank you.
Thank you, sir.
Bye-bye.
You bet. Take care. Bye-bye.